Good evening, ladies and gentlemen. Welcome to Allure Medical Spa and How to Look Younger in Minutes. I'd like to introduce you to Dr. Charles Moak, and he's going to be conducting your seminar on the Magic Lift. Welcome.
Thank you. Okay, thanks. I'm going to key up my PowerPoint here. So thanks for coming. We're going to talk about some of the changes in how we approach facial aging. The facelift was a surgery that was done for years in order to tighten up the skin and muscle with surgery. And you're going to turn me down a little bit. And it didn't address one of the key components of aging, which is deflation of the skeleton. So moving forward 20, 30 years, we find that when somebody starts getting a saggy face, they didn't start growing new skin unless they were really heavy before and lost weight. You've seen where somebody lost a lot of weight and their face kind of falls. But you don't grow skin as you get older, and you do lose a little bit of elasticity, but mostly the deep fat pockets of our face deteriorate and they flatten out and they get smaller and smaller. And by using that same effect of aging, we can actually correct a lot of the appearance of aging without looking fake like a surgery potentially could do. And there still is a role for surgery, but we're doing it much less often, probably 90% less often than we were, say, 5 years ago. So we're talking about the factors that influence aging. Obviously, there's deflation we just talked about, and that's where your face gets thinner and it looks heavier on the bottom. If you go to church and you look at the grandmother, the mother, and the daughter, you'll see a progressive hollowness of the temples and the mid-face, the orbit, the jaw gets thinner, and then the face drops. You have deterioration, that's basically sun damage, to where you get some discoloration and redness and blotchiness, and then things kind of descend. So those two things together let the face descend. The deterioration has some degree with elasticity, so by fixing deterioration we get some degree of tightness, but mostly it's through correcting the deflation. So what's most damage from, what do you suppose is the biggest thing that damages your skin? Sun, right? Ultraviolet exposure. So wearing sunblock is obviously protective. And people in our generation, for the most part here, we're kind of putting oil on back in the day. I didn't as a kid. We just would go out there and cook, and then not worry about it. And it's even hard for me to explain to my kids. They have my skin. They never sunburn, and they're kind of reluctant to put some sunblock on. But that's something that's really important that you teach your kids young, is to put sunblock on and reduce their chance of skin cancer. So sun, obviously lighter skin is more susceptible. And ultraviolet light also oxidizes the skin. So when you damage the skin, your skin has an ability to repair itself. And that ability to repair itself decreases over time. Then you start getting discoloration and roughness and problems with texture. This is called the Visia. We have a couple of these here, and it basically put your head in the box, and it takes the ultraviolet light and measures things like pore size and wrinkles and sunspots. And so when we're doing things like topical skincare or certain lasers, we can kind of get an objective measurement of how much improvement you had. So topical solutions, vitamin C is protective and it lasts about 36 hours. You put vitamin C on in the morning, it protects you from the sun in terms of protecting your collagen and your elastin. It doesn't really keep you from getting a sunburn. So you have to reflect sun to get a sunburn. Vitamin A, which actually makes you a little sun sensitive, so that's something you put on at night, and that's more repairing. Normalizes cell turnover, and then glycolics, which increase the moisture of your skin. So sunblock goes on sort of after that. Now there's two different kinds of sunblocks. There are ones that have the metals in them, like titanium and zinc, and there's the new ones like Mixoral and Helioplex, which are designed to absorb the sun. And the newer ones, they're claiming better sunblocking effects. Well, back in the 50s in Korea, they measured the SPF on sailors standing on a carrier, and they figured out how long they could stand out and before they got red. And that's what they determined you can block that and create a SPF of 1, 2, 3. It means if like a SPF of 3 will give you 3 times more time in the sun. But it only really measures the effect of ultraviolet B. And ultraviolet A is the one that can penetrate through glass and get deeper in your skin and damage your fat pads and your deeper tissues. And the Mixoral Helioplex don't really protect that very well. So typically, you probably want to use something with titanium or zinc in it as a base because it reflects light, just light in general. Versus the other ones just absorb certain ultraviolet rays. So this is an example of a patient that I had seen, and this was in our old bills years ago picture, but she had come in here and was put on topicals, and she came back in a year later, and we just took a picture again and just did a close-up. She didn't do any Botox or anything in the interim. Did some tightening over time. If you put the cream on tonight, and tomorrow you look, you go, stuff didn't work. Well, that's because it's really too soon, right? So sunblock, obviously, putting it on all the time will slow down aging, and you're still going to have signs of aging, but there would be less than if you never did anything. Okay? So first impression is your eyes. Brow position sort of expresses emotion or interest. And arch to your brow gives a feminine personality or a masculine personality based on how your brow is, and youth. And eye color and lashes, they're beauty. Now there's drops people use to enhance their eyelashes. It's called Latisse. And you put it on every day for a couple months and your lashes get about 50% longer, 25 to 50% longer, and about twice as thick. They get a little bit darker. And that's something that people typically use it for 2 months, and then you put it on every 3 days, forever. It just stimulates eyelash growth, makes your eyes look prettier. Then we look at the aging face. Again, deflation, deterioration, descent. So one of the common problems is that our muscles overgrow, which causes us to descend. So in this case here, she's got this furrowed brow, which has dropped her eyebrows. Her eyebrow has become a little bit masculine looking. It's no longer arched. And so she would like to have Botox up here. When in reality, the reason these lines are here is she's fighting these strong muscles here in order to be able to see. So if you have a heavy brow, then you got to go like this here to see, and you get the forehead lines. And it's not attractive in women. So we'd put Botox right here instead of in the forehead. You see how I lifted up her forehead and relaxed them. Now if you treat the forehead, typically the brow will drop. And that's the most common mistake in Botox, is going after the forehead lines. If you could treat the forehead lines after you've treated the muscles that push the brow down, but if you do it up front, it actually progressively drops your brow. You see over time, women's brow will get lower and lower and lower. It just doesn't work, so it's a treatment failure. Here's an example of somebody who had Botox, and she still had this sort of stiffness to her brow right here. So I put Botox right in this muscle called the orbicularis. So when you squeeze your eyes, you've got muscles that, it's like a purse string, and it squishes down, and the top portion of it pushes your brow down. The lines of anger are also depressor lines. So we put additional Botox right here. And just 4 units of Botox. You see how much lift you got? So it's about placing it in the right spot. Okay, and that's really what Botox is about, is putting it in the muscles that you don't really need. Mantox. It's very much like Botox. So men do not want an arched brow, so we treat it differently. Instead of doing the muscles here, the corrugators, I just put it right here in the center, and this is a strong muscle called the procerus, and it pushes the brow down. You see how much he lifted up. And men will accept a flat brow and some lines in their forehead because it still looks masculine, but he wants to be able to see. You see how much lift he got. Like it looks like an eyelid surgery. Again, the same problem, concern regarding the forehead lines. Now she had both strength here, and she also had very strong muscles here. This is called the gabella, G-A-B-E-L-L-A. This muscle is called a corrugator procerus, and orbicularis oculi. And those are all muscles that push down. And then there's one muscle called the frontalis that's the only levator you have. So you have one muscle to lift your brow up, and you have 5 muscles plus gravity pushing it down. So we want to treat the gravity muscles. So we put the Botox right there, and you see how much she lifted up, and her forehead lines are gone because she's no longer fighting to see. Okay? Same thing here. She has a nice arched brow, but she has worry lines, forehead lines, and I put the Botox in the same places. All the muscles are depressors. You see it just makes the brow look prettier. And you can't even describe what happened, but if you look carefully, look where the eyebrow line is here, and her bone's right there, and look where her eyebrow line is here, and you can see the bone underneath it. Women typically look prettier if their hair is above the bone. Okay? Whereas men, we don't want that. That doesn't look masculine. So here's some stars when they're young. And we look at the triangle shape of their face, nice full upper face and thin lower face. And here's what happens when we age. Okay? More like a trapezoid. But if you notice, particularly, is his temple is hollowed out, and his mid-face is hollowed out, his chin's thinner, so things fell. Okay? He didn't grow more skin, he simply deflated. And this is what happens when we look at, it's kind of gross, but cadaver studies. If you donate your body to science, there's a chance I'll be sitting in a lab somewhere digging it apart. I was at one lab, a cadaver lab, and the lady sitting next to me, she got, she was kind of grossed out by her head. And I said, "Can I have your head when you're done?" but that's what happens, unfortunately. That's how we learn how to do surgeries and stuff. So here's a woman in her 20s or 30s, and she has fat pads around her orbits. Big malar fat pad, that's one of your stronger fat pads. The temple fat pad's a strong one, and then entirely along the mandible there's a fat pad. In about mid-40s, these fat pads start shrinking. And we don't know if it's from the sun or just normal processes of aging, because we should be able to grow more fat cells, but they do die out. And this is what happens years later. is the fat pads get thinner and thinner and smaller and smaller. Now interestingly, today we treated a patient with Lou Gehrig's disease with stem cells. Okay, we do stem cell therapy in our office, and the patient was dying of Lou Gehrig's disease, and we take the fat out of her stomach and take the stem cells out. You have enough stem cells in your fat to live to be about 500 years old. Stem cells in your fat exactly like the ones in your knee and your heart and everywhere else. And when people did studies looking at how long man could potentially live without disease, they guessed about 500 years because we somehow were programmed to have enough fat cells to live that long. Like, why do we have that many fat cells? But the ones in your stomach or your butt or your back, they stay there very nice and rich, but the ones in your face decline. And when they first discovered mesenchymal adipose stem cells, which is fat-derived stem cells, there was a doctor in Korea and also doctors at Stanford University, and they were trying to figure out what happens when we put fat transfers into the face. Like, how many cells survive? We put 1 million cells into 1 million cells survive, or 1 billion to 1 billion survive. And the logic had been for forever that you were born with a certain number of fat cells and they eventually would just, that's all you have. They don't really turn over. What they found is that about 6 months out, which is when fat seems to take, the fat cells that they biopsied were babies. They were new fat cells. And that led to the discovery of stem cells. It was through looking into plastic surgery, which happens with fat transfers. So what happens is in your fat, you've got a bunch of little tiny stem cells. They could be pre-adipocytes, which mean they're particularly programmed to become a fat cell, or they could be just what's called mesenchymal fat cells. They can kind of turn into anything, a blood vessel, a heart, a knee. And so we can harvest those out and put them into the knees. Or treat, we put them into the spine for people with multiple sclerosis and they get better. So the facial fat cells lose their stem cells for some reason. They don't regenerate, and maybe it's from the sun. We don't really know. This discovery has only been about 8 years, so people don't quite understand why certain parts of their body have lack of stem cells. But interestingly, we have a cell counter, so when I do my cell counts, I was able to learn how to do a better job. And if I liposuction very close to the skin and comb off the skin fat cells, I get more. I get about 50% more stem cells. Whereas deep, there's not very many of them. We don't need them there. And my assumption is the sun is going to penetrate your skin and is going to probably damage some of the stem cells or kill your fat cells off quicker. When I do tummy tucks on people that have had severe sun damage, the sun went all the way down to their muscle. You can see that the tissue is all damaged. So sun protection may be beneficial for deflation. Maybe our children who are using sunblock at a young age are going to have less aging deflation in their face. We'll see. That's just an interesting side note. But the fat pockets decline everywhere in the face, and really, if you notice, nowhere else, right? Restoring deflation, loss of volume around the eyes, skeletonized appearance, age appearance, restore with filler or fat. Now the fillers that we use today are called hyaluronins or hyaluronic acid, and it's a naturally occurring product that occurs in your body, and it declines over time, it deteriorates over time, breaks down. You have a naturally occurring enzyme that eats it up. And interestingly, the more you put in, the longer it takes to break down, and the more often you do it, your body starts ignoring it. I did my wife's lip filler 2 weeks ago. First time she had it since 2011. I could still feel a filler in her because she had it a few times. I had a patient who had been kind of like one of these ladies that likes the lips being a little bigger. And I lost her for about 5 years. She had babies and disappeared for a while. She came back in. We took her pictures and looked at them, and her lips were still fuller 5 years later than they were when we first started. So you do get some permanence. And people say, well, I want a permanent filler. The problem is filler problems do occur. Okay, we'd like them not to occur, but they do occur. And they occur at a low rate. Okay, about 1 or 2% of the time there's a filler problem where you may have to dissolve a little bit of it or something. You have to deal with something that's a little swollen. And they're minor, and they go away, and they're not serious. But permanent filler problems are permanent, okay, and they have to be taken out. So I'm not a big fan of permanent fillers. I've had to go fish it out before for people that had permanent fillers put in Europe, and getting it out is, you got to make a cut to get to it. Because sometimes they get what's called a granuloma, where they get it grows into almost like an abscess. So we typically use temporary fillers. There's some permanent fillers called Belafil and Sculptra that have a good safety, but in general, that's going to be put in a very deep area and somewhere I can go get it out without cutting your skin if necessary. So we might use that in the cheek. But typically we're using the hyaluronic acids. And they have the benefit of being extremely predictable and extraordinarily safe. And they are dissolvable. Okay, so every now and then there's like a lump somewhere and you just make it go away. Okay? And the 1% doesn't sound like much. In our practice, it's less than 1%. We look back, it's probably about 0.1%. But the problem is that we do thousands of these a year. So statistically, okay, we would have problems if we used permanent fillers, and they would not go away. So I really don't want to do much of that in our practice. So I remember there was a doctor out visiting, we were training him, and he really talked about, he was kind of gung-ho on permanent fillers, and I explained to him the problem with the permanent filler is you're going to be dealing with this patient the rest of your life, with steroids and like that. I said, so only put in somebody with permanent filler that you're willing to marry or something, right? Because you're going to be seeing them forever. So I want to get off that permanent filler bandwagon and realize that it's not the best option, okay? And the non-permanent fillers kind of become permanent, but without the negatives. So here's an example of a woman who had concern regarding jowls and mid-face and hollowness. And the filler she got Botox, filler here, filler along the jawline. You saw that video of us doing it. And there she is afterwards. Again, it looks like she had a facelift. It just looks natural and looks like herself. It looks like she did 10 years earlier. Okay? And that's just with filler. Now, one of the things that happened with fillers is that we're the biggest customer of fillers in North America, probably in the world. And we made a deal with Allergan, the manufacturer, that I wanted to use more. But their price system was based on charging per syringe. And their average person gets 1.2 syringes. I mean, somebody gets 1, somebody gets 2. And you get a little bit of results, and it works okay, but people weren't that happy about it. So I brought the head honchos in for the company, and I wanted to show them what my concept was. This was a while ago. We brought in some women, this is one of them. And I said, just bring me a bunch of filler, and I just want to pretend like cost is no object, which it wasn't, they were paying for it. And that was 30 syringes, okay? Now the concept, oh my God, 30 syringes is gonna be so big. 30 syringes is 6 teaspoons. And I showed you the fat pad pictures. And the reason I decided to do that with the company is, first off, we couldn't afford to do it because they charged so much for the filler. But I knew from looking at cadavers and studying anatomy that it's more than 1 cc of fat that you lose. It's about 6 to 10. So we need more. So right now we've been so far about a year with the company where they rebate us. So if we buy 1 syringe of filler for 1 person, we got to pay a certain amount. But if we buy 20 or 30, we don't pay 20 or 30 times as much, which makes it like practical. Here's another example. This is one of my doctor's friends. She brought her in to do the magic lift training. We were kind of testing it. So that first one was the first patient I ever did with 30 syringes, and this is the second. And that's her just with filler and Botox. Again, you can see the cut of her jaw and her neck. So in this case, she had filler, temple, mid-face, mandible, mentalis, piriformis, and mental area. And this lifts the face. So basically reinflating the fat pocket. And the way I do this is I know the anatomy, and I put the filler right where the fat's supposed to be. Okay, so traditionally, the manufacturers of the filler has been training us to kind of fill the nasolabial fold and fill the lips and fill here. I mean, it kind of works, but it doesn't work like this does. Okay, this is just fixing the problem rather than masquerading a solution. It's like if you put on a lot of weight, buying a bigger dress, this hides the problem. But exercise and diet, this is like the exercise and diet. This is fixing the actual problem. Older woman with more severe sagging, obviously, because as we get older, we deflate more. And this is just pure Botox and filler. And look at the cut of her jaw here to here. It's lifted her mid-face up. She no longer looks as sad and stressed and worried. So Botox and filler. That's just filler. It's about 35 syringes of filler. This one you saw in the video. So she had some jowls, deep nasolabial folds, hollowness here. I didn't really put any filler in her nasolabial folds. That's what we were kind of trained to do traditionally 10 years ago, is put it in here. And that's what people are doing. So we did her temple, her mid-face, and her jaw. So imagine if you filled this up, it's going to lift that marionette line up. And that's her immediately afterwards. That's why her lips are swollen. We did her lips too. The lips are the only part that really swells. Everything else doesn't seem to swell much. And even kind of aches a little bit afterwards. When I treat employees or family, they say, yeah, I feel kind of achy, but not enough that you're taking a Tylenol, okay, because you did get some filler underneath your muscles. But there's no downtime. There's essentially no pain other than this vague achiness that you know anything for. And unless you do your lips, there's no swelling, and there's always a possibility of a bruise, because it's a needle. So if we bruise you, then that's something you got to be prepared for. But if you look at the angle of her jaw here, it's gone. And that's 1 minute after I finished. Okay, so it's instant. And unlike a facelift, you don't have to go to a Myers in another community for the next 3 weeks, right? You look good right away. The same side view. Again, just lifted up. Her whole face is rotated upwards. So here's a guy with eyelid problems, and this traditionally was treated with surgery. And if anybody's ever seen Kenny Rogers or Burt Reynolds after 17 eyelid surgeries, you know it can happen, right? And that doesn't happen with one surgery, obviously, but a young man, this guy's only 53. If he does eyelid surgery now, it does kind of fall apart. And the problem is not so much that he grew fat here. Okay, he did not grow fat here. There's something called a zone of adherence right here where the tissues are totally separate. Like when you were pregnant, you sort of had a big belly and then there was like a crease or a line that stays there. That's a zone of adherence. That's where their tissues stop things from, kind of communicating. So there's a little zone of adherence here. There's also a zone of adherence here. That's why when your face deflates, it folds right here. I have lines because I don't have any filler in. So we put filler in his cheek, about 20 syringes, and that's no surgery, okay? I asked him, I said, what we should do for the after picture is get rid of the 70s haircut. But that's, okay, so it is a modern picture. I hope it's Jen here, it's her dad. Okay. Again, magic lift, Botox and filler, just re-inflating the face. You see, she just looks happier, more effeminate, no surgery, and no risk. This lady had more like 40 syringes of filler, and it's hard to estimate when you're looking at these pictures how much I use, but I can just basically, I know where the fat pads are supposed to be and what they're supposed to look like. I like seeing when people bring pictures when they're younger. I might sometimes underestimate. We can see a clear hollowness of her temple, hollowness of her orbit, okay? And when this eyelid skin falls, it's frequently because the fat here went away. There's a little fat pad there. So when we do Botox and people don't get much lift, we actually put filler right here in their bone. And mid-face, hollowness to her chin. And that's her 1 week later. Okay, Botox and filler, nothing else. So you look at the difference here, and it looks like her face has been lifted up. Now, one thing that I haven't been able to accomplish yet is lifting up these neck bands with filler. So I'll put Botox in there, but occasionally we'll do something like Allure, which is a heat device that gives an injury below the skin to pick up the neck. The neck gets better, but it doesn't get corrected with the magic lift. Again, this is a side view, and her face looks just youthful. And when I talk to patients about using the filler, I don't really explain how many syringes I'm going to use. It tends to make people paranoid because we're not having a half an hour to discuss it. But 30 syringes of filler is six teaspoons. It's not that much. And it's probably barely what you lost. So restoring deterioration, what about when your skin has got discoloration and brown spots or redness? Well, we use lasers or light of some sort that treats brown spots and wrinkles and pore size, redness, acne scars. This is Angie. I think she's here somewhere. She left. Oh, she's working all day. So she had this melasma, and this is when she first started working here, and that's 2 weeks later, just doing one laser. And if she was here today, you'd be able to see her, but I guess she had to go. This is a friend of my mom's who said it didn't work when she had Fraxel. And I said, can I use your pictures to show everybody it doesn't work? After one treatment that's read for 3 days, that's inexpensive, and no risk, right? But you can see that, everything's not gone, but this is not the magic, but this is the Fraxel laser. So the Fraxel laser has the advantage of being extraordinarily safe and repeatable. Now the gold standard laser for years had been what's called a carbon dioxide laser, and we have one, it's a 2006 laser. And it does better than this with way more risk and downtime. Okay, so you're better off doing 2 or 3 of these than one CO2 laser. With the carbon dioxide laser, you are red for about a month or 2. And we do that when we're doing surgery because people in surgery are prepared to look bad for a while and risks. But it's not really worth it for non-surgical stuff. Okay, so you can do the Fraxel and then in a few days you look fine. Usually there's no peeling, but it's like redness, like a sunburn. People say it hurts. I had it done once when we first got it. I fell asleep, so I don't know how bad it was, but it's not horrible. But the Fraxel laser does have some discomfort, so they numb you up. It's something you can drive yourself here and drive home. And you can go to your own community Myers in about 3 to 5 days. Okay. Again, this minor photo damage. And this is without Botox, and even her wrinkles got better around her eyes. We usually do Botox at the same time. But you see the plaques and the discoloration. So what about surgery? I tell you, we're doing way less surgery now for facial aging, but there's still a role. So this here is a Botox and laser problem. Okay, so Botox corrects this, and the surgery will not correct it. Maybe a little eyelid skin removed. Okay, but to make the face look not mad, we would use Botox, and to even out the skin, we'd use a laser. Face and neck. This is surgery. Okay, so she had more advanced aging, and she was concerned about her neck. And the neck, I don't really get much lift with the filler. And you can see the neck is gone. So if the neck is the main concern, then we're talking surgery. We're still using a filler or fat transfer or something of that nature. So that's the same lady before and after surgery. The same thing, surgery. Both these ladies are in the late 60s. This look younger and better. This is surgery, laser, and Botox. So the magic lift is for the person that's not interested in surgery, which is a growing part of the population. Also, we get started earlier, the surgery may never be needed. And the surgery is needed when the neck's gotten too lax or is maybe a little bit too severe. And as time goes on, we'll maybe figure out how to lift the neck without surgery better. Right now, it's going to be using a filler plus like an Althera. So surgery works better for that, but it's not the right answer for most people. Okay, most people just need volume. We have a microphone for questions. Questions? Yes.
Well, if he has a magic lift, how long can you expect results? Does it last?
That's a great question. So if you have the magic lift, how long can you expect it to last? So the fillers we use, the duration is based on how much is used and how many times you've done it. So typically the first time you do it, it'll be a lot of filler, and in about a year it's maybe a third gone. So you're doing not quite as much again, and you're probably doing it every 2 to 4 years after that. Okay, maybe after 3 or 4 cycles you're not doing it again for a few years. My mother's here, and she had filler when we're doing training and stuff like that, but she's had it a few times where it just seems to last. The filler I put back in 2004 kind of still seems to be there because I didn't fill that area ever again. Pretty rare it does happen. The filler is a totally different animal, so it's a different process. So we wonder why sometimes Botox doesn't work very well or very long on people. So a study was done, it was called a crossover double placebo-controlled trial, where they discovered, based on the fact that Botox is what's called a zinc metal peroxidase, is it the lack of zinc. So they took people that had the non-responsiveness to Botox, and in half of them they just did regular Botox, and then the other half they gave them phytase, or something they give to animals to be able to digest zinc, because they eat corn, and zinc 3 times a day. And they found they could pretty much correct the inadequate durability of Botox by taking zinc and phytase. Now phytase is in animal feed, so that's not practical. But if you don't take phytase, all you gotta do is avoid grains for 3 days. Okay, so grains block absorption of metals. Okay, so if you eat a lot of like cereal, you actually get depleted on minerals. That's why the US government requires cereal manufacturers to stuff them with minerals, even though they won't be absorbed because you eat the cereal blocks. I mean, it's on the food pyramid, eat 11 servings of grain a day, and then they want them to add all these minerals that don't get absorbed anyways. It's ridiculous. But grains do block absorption of minerals, and zinc deficiency, relative zinc deficiency, is probably the most common cause of Botox not working very long. Okay. Any question in the back?
Does Magic Lift apply to women of color?
So the Magic Lift applies to women of color. Everything we did applies to women of color except for certain lasers. Okay, so color has no bearing on it. Now women of color typically are going to deflate less because they have better sun protection. That's why Asian women and African American women, they typically look younger than a Caucasian woman that lives in the sun because they have a lot of sun protection, and their fat didn't depreciate as much, but it does work for them. Things like Althera and Thermage, which are the tightening procedures, those can be used in any color. And the Fraxel laser, it can be used in dark skin, but it's got to be used like much lighter settings, like much lower energy settings. Other questions? We have one in the back, and I'll ask you.
Can you explain what intense pulse light therapy is?
Yeah, can you explain what intense pulse light therapy is? So it's a older treatment that still, we still use today, maybe not as much, but it's basically a non-laser device that uses a bright light that's designed to burn brown and red. And what it does, you go over your whole face and it cooks the brown and red, and they flake and fall off to some degree. It also stimulates a little bit of collagen. We're not using it that much anymore because we have devices that work better. They're more energy. So it's still a role for somebody who says, I don't want any downtime at all. But if they don't mind being red for a day or so, we'll use something much stronger. So it's got the advantage of being very gentle, maybe not working so great. Question here? Yes.
You had said about the few risks there were, and I know Botox and fillers have been around forever, but is there any level of slight correlation with any kind of cancers or anything like that related to any of these?
That's a good question. There is no permanent medical risk associated with Botox or filler. So Botox has basically a couple risks. First off, doing it incorrectly. You know, I talked to you about the brow dropping. The most common problem with Botox, people come in and they're opposed to it because they had it before and their brow looked masculine. So then we explain to them about that's not the way you do Botox, don't worry about it. And the second problem with Botox is every now and then you'll get a droopy eyelid. Okay? So what happens is occasionally it'll penetrate down to the bone and drip down into the muscle that lifts your eyelid up. If that occurs, you got to wait it out, but there's a drop you can put in your eye that'll stimulate another muscle. So I've seen that probably like 3 times in my career, and we just give them a drop and it lifts up. Unfortunately, it just goes away, usually in about 2 or 3 weeks. For filler, there's basically one reaction, and that's called a sterile granuloma. It's like, it almost looks like a pus pocket or a zit, and there's no bacteria in it. And what we do is we just inject it with a dissolving agent, wait for it to go away, and then fill it again. Okay.
Immediate that shows up right away?
It can be delayed. Now here's the odd thing. We've done more of these than anybody in the country. And Voluma, which is the new popular filler, they claim it occurs 2% of the time. Never seen it. Okay, I've never seen it. I have seen it with other fillers. Patient come in from other practices that we don't even know what they use, or something from out of the country. We have never seen it with Juvederm or Voluma. I don't know where this 2% comes from. I don't quite understand it. Maybe they're not using a septic technique or something. But we do more than anybody in the country. I've never seen them. My friends, they've seen them. So the craziness or the things you see or the things they're made fun of are really not practical. You know, about 6 to 10 million people get Botox every year. You don't know who they are. One of my employees was saying that she was talking to a patient, and the patient had a bruise, and she was really concerned. She never told her husband that she did Botox, and she acted like so surprised. But he goes, "My husband doesn't know. He knows we work here, but he didn't know I had it done." Right? A lot of women hide it, and then some women just they overdo it. Right? I watched the Real Housewives of Beverly Hills. My dad, I had a YouTube sent to me, and there's like no movement. Right? They've been over treated, and that is a fake look. So a fake look goes from just not knowing when to stop. Okay, just like the eyelid surgery with Kenny Rogers and Burt Reynolds. You know, one of those surgeons should have said, stop it, your eyes look fine. Yes, question back here?
Are there any medical conditions or medications that would mean that you couldn't have this? And is there an age cutoff?
Okay, that's a good question. Are there any medical conditions that you couldn't do it as an age cutoff? The medical condition of myasthenia gravis and Graves' disease, where there's a problem with the Botox-like effect to begin with. They have like a Botox-like effect in their body, would be a reason to use it with lower doses. So when people come with those conditions, we just do one area at a time, and that's known to be safe. So the answer to that, there's no medical conditions other than using caution in people with neuromuscular disease. For the filler, if you are on a blood thinner, you're more likely to bruise, but you just take that risk. There is no age cutoff. Okay, we have patients in their 90s getting this done. And women always say, like if a woman's 30, she'll be convinced when she's 50, she will not care what she looks like, right? When you're 50, you think, when I'm 70, I do not care. When you're 70, like 90, and so it's just like a matter of perception. Any questions? Yes?
So is magic lift something you just determine by patient, or is it always Fraxel, filler, and Botox combined?
So the question is magic lift something you determine by patient? Well, so when somebody wants facial restoration, we do, the magic lift is our primary thing rather than we used to do like 3 syringes of filler. And the Botox comes free with it. The company gives us some Botox vial whenever you get the magic lift done, so you might as well get it done. And then what happens with the magic lift, the way we price it is that you get the 2 things together, and we make deals with the companies to get discounts on other things. So if you get the magic lift, you get a discount on Fraxel or on all therapy, which lifts, or on different things. And they can show it to you when we go back and do a little tour of the office, they can explain it to you. So probably over half the people get something along with it, like a Fraxel or some lifting procedure.
Which lift do you use? Is it the one you're calling Voluma and all that?
So which filler? The filler we use is the Juvederm products. That's from the Botox people. The Voluma we put deep, and then we layer it with regular Juvederm. Okay, so it's a matter of, yes?
I walked in a little bit late. I think there's something about a antioxidant topical that you had up on your slide. Is there something unique about that in your product line, or is that something you can just get at a pharmacy?
The vitamin C and retinols, which is a vitamin A, are pretty commonplace in the aesthetic market. The glycolic is probably the most common anti-aging moisturizer used on the planet. So we've selected ones that seem to come from the best manufacturers, but it's not like there's not something great out there. You look at like the Obagi line of products and the Perricone line, they're great too, but they cost way too much. So these are, from a practical standpoint, from the cost and benefit, they're the best we can offer. Otherwise we'd be selling Obagi, it's just too pricey. So you can get them at a pharmacy, more like a it's not a prescription, it's considered what they call medical grade, but you can find it at over the counter.
Is retinol or retin A considered an antioxidant?
So no, it's not. So the question is, retinol or retin A considered antioxidant? It just kind of normalizes turnover of cells. So retin A is an acid form of vitamin A, and retinol is an alcohol form of vitamin A. The retinol is the advantage of not being irritating. So retin A you would use for, say, acne, but it's better to use a retinol for aging skin.
Is the antioxidant then a vitamin C?
Yes.
Okay.
And there's other antioxidants too for problem specific. So many, you look at all the different vitamins you might take for your health purposes. Some of them have benefits in your skin. CoQ10, which people take for heart disease, seems to protect against melanoma cancer. That's good. It's not. They call it ubiquinone, which is actually CoQ10. Other questions? So yes.
Can you use retinol on your eyes? You showed that one.
Yeah. So the one picture I showed, she had DMAE, which is an anticholinergic, vitamin C, alpha lipoic acid, and estriol, which is a skin estrogen. And that's like the Perricone prescription. So I had it made for. But yeah, you can use that retinol underneath your eyes.
Thank you.
So when we talk about, let's say we're going to brought up the estriol. So estriol is a form of estrogen that's present in pregnancy and in small amounts the rest of your life. And when you age, you almost don't make any of it. And they showed an Austrian study in '96 that if you put estriol on your skin, increase your moisture content by about 300%. Has no negative effects in your body. So that some women use that and they put it on their skin to brighten it up. That's why you get the glow in pregnancies from all the estriol. Yes?
Where do the prices of the Magic Lift start at?
That's a good question. The price of Magic Lift start is $2,000, $4,000, and $6,000 typically. And it's based on how much filler you need. And the Botox comes with that. So we have some, I think we're going to do a drawing here, and then we have some on both sides of the office going this way or this way. There's going to be a bunch of photos and machines over here. You can see a live demonstration of a facial tightening procedure. You can ask my staff questions. There is some special pricing tonight, so if you put it down a deposit, they'll give you a discount off the Magic Lift. And if you don't know what you need 2 or 4, you don't have to know that. You'll be able to talk to the doctor, get a consult, and see what you need. Any other questions? Now we'll do that. Yes, in the back. Bring the raffles up, ladies. Here you go, right next to you.
There we go. Thank you. Can you correct an eye that is drooping with a filler, an injection, something?
So can you fix
one
an
is
eye?
good, the other is drooping.
Yeah, so if you have a droopy lid and one is not, usually we use Botox to even that out.
And that would pull it back up?
Well, see what the Botox does, it'll weaken the pressure muscles so the frontalis will naturally lift it up. So somebody with a droopy brow, the treatment is to leave the lift muscle intact and weaken the pressure muscle.
Okay, thank you.
Certainly. So we're going to do a drawing.